Before we begin, please remember that the information shared in this video is for educational purposes only and isn't a substitute for professional medical advice. Always consult your healthcare provider before making changes to your diet, supplements, or medications. Now, let's get into today's video. If you care for an older adult, this is a practical point to keep in mind. Are you tired of taking handfuls of pills every morning? Many seniors are looking for natural ways to support their bone health and immune system beyond just standard D3. Today, we're looking at a specific mushroom that research suggests could offer unique support and how to discuss it safely with your doctor. Alright, let's start with the real-world problem. As we get older, our bodies change how they process nutrients, which is why vitamin D becomes such a hot topic. As we age, our skin becomes less efficient at converting sunlight into vitamin D. This means even if you spend time in the garden, you might not be getting as much as you did in your 30s. It's a common reason why many seniors see their levels dip during the winter months. Understanding this helps you realize why dietary sources or supplements are often suggested by providers. Vitamin D is essential because it helps your body absorb calcium, which keeps your bones strong. For seniors, maintaining bone density is a top priority to help reduce the risk of fractures if a slip happens. It isn't just about the bones, though. It also plays a role in muscle function. Keeping these levels steady may support better balance and stability in your daily walk. Research suggests that vitamin D plays a significant role in supporting a healthy immune response. As we get older, our immune systems can use all the natural support they can get to stay resilient. While it isn't a may-help support for the common cold, having adequate levels is associated with better overall wellness. This is why many healthcare providers prioritize checking these levels during your annual physical. Now, let's look at the mushroom connection. You might have seen maitake or portobello mushrooms mentioned as a natural source of vitamin D. Mushrooms are unique because, like humans, they can produce vitamin D when exposed to UV light. Specifically, they produce vitamin D2, which is a plant-based form of the nutrient. Some growers specifically expose their mushrooms to UV lamps to boost this content. This provides a whole food way to incorporate more of the sunshine vitamin into your diet. Maitake mushrooms, often called hen of the woods, are frequently cited in research for their potential wellness benefits. They contain beta-glucans, which may support heart health and immune function alongside their vitamin D content. Shiitake mushrooms are another popular choice that are easy to find in most grocery stores. Adding these to a stir-fry or soup is a simple way to diversify your nutrient intake. It's important to know that most supplements use D3 cholecalciferol, while mushrooms provide D2 ergocalciferol. While both raise vitamin D levels in the blood, some studies suggest D3 may be slightly more effective for long-term storage. However, D2 from mushrooms is a fantastic option for those who prefer plant-based sources. Neither is better for everyone. It really depends on your specific health goals and diet. Quick reminder, this isn't medical advice, and it's always best to consult your doctor before changing supplements, medications, diet, or exercise. If you're thinking about adding a mushroom supplement or more vitamin D to your routine, there are a few practical things to look for on the label. Supplement labels can be confusing because they use both international units IUs and micrograms mcg. For vitamin D, 400 IU is roughly equal to 10 mg. Most seniors are advised to look for specific ranges based on their doctor's advice, often between 600 and 2000 IU. Always check the serving size to ensure you aren't taking more than intended. Many cheaper supplements use fillers like maltodextrin, hydrogenated oils, or artificial colors that you might want to avoid. Look for clean labels that list the mushroom extract or vitamin D source clearly. Some people have sensitivities to certain fillers, which can lead to digestive upset. Choosing a reputable brand that prioritizes purity is usually worth the small extra cost. Since supplements aren't regulated like medications, look for seals from organizations like USP, NSF, or Informed Choice. These seals mean a third party has verified that what is on the label is actually in the bottle. This is especially important for mushrooms as you want to ensure there are no heavy metals or contaminants. It gives you peace of mind that you're getting a safe product. Let's talk about some of the pitfalls seniors often face when trying to improve their vitamin D levels naturally. Vitamin D is fat soluble, meaning your body stores it in fat cells rather than flushing it out like vitamin C. Taking extremely high doses without a doctor's supervision can lead to toxicity, which may cause kidney issues or high calcium levels. It's always better to aim for the sweet spots recommended for your age group. Balance is key to avoiding unintended side effects. Vitamin D and certain mushroom supplements can interact with medications like blood thinners, steroids, or weight loss drugs. For example, some mushrooms have mild blood thinning properties that might add to the effect of your prescribed medication. This is the most important reason to share your supplement list with your pharmacist. They can quickly check for any red flags that might affect your safety. While mushrooms are a great addition, it can be difficult to get 100% of your vitamin D from food alone, especially if your levels are already low. Think of mushrooms as a supportive team players in your diet rather than a total replacement for what your doctor prescribes. A combination of safe sun exposure, a balanced diet, and targeted supplementation is often the most effective approach. Don't feel discouraged if you still need a supplement. Before you head to the store, here's how to have a productive conversation with your healthcare provider about your vitamin D levels. The only way to truly know if you need more vitamin D is through a simple blood test called the 25-hydroxy-vitamin D test. This gives you a baseline number so you aren't just guessing. Ask your doctor to include this in your next routine blood work. Knowing your number helps your doctor give you a specific dosage rather than a generic suggestion. When you see your provider, ask specific questions like, based on my current medications, is a mushroom-based D2 supplement safe for me? Or, what is my target vitamin D range? Bringing the bottle or a photo of the label can help them give you better advice. It turns a vague conversation into a practical health plan. Your doctor is your partner in navigating these choices. Once you start a new routine, pay attention to how you feel over the next few months. While vitamin D changes happen slowly, you should report any new digestive issues or skin rashes to your provider immediately. They may want to retest your blood levels in 3 to 6 months to see if the plan is working. Consistency is important, but so is staying observant of your body's signals. That's the practical version of how mushrooms and vitamin D work together for senior health. The big idea is to understand your specific needs through testing, choose high-quality sources, and always keep your doctor in the loop to avoid interactions. Mushrooms are a wonderful natural support, but they work best as part of a supervised health plan. If this helped you feel more confident about your health choices, please like and subscribe to Senior Wellness Tips. Don't forget to share this with a friend who might be curious about natural support. We'll see you in the next video. Leave a comment with the health topic you want explained next. Thank you for watching. Remember, everyone's body is different, so please discuss any changes with your doctor before trying anything new. If this video helped you, please give it a thumbs up and subscribe for more senior wellness tips. Stay healthy and take care.